It is currently 9 a.m. and Nurse Emma is 2 hours into her 12-hour shift. This is the 5th 12-hour shift she has worked in a row.
Oh, it looks like room 5's lights on again. What can I do for you?
My pain's at a 10.
Okay. What would you like to take for that?
Can I have my NURB, please?
Okay. Would you rate your pain for me on a scale of 1 to 10?
20.
Oh. Okay. Well, I'll go get that, and you just stay right there. Okay. All right. I'm in the fixer's room. This is my 5th 12-hour shift in a row, so I think I need this more than she does.
It has now been an hour and the patient is still a 10 on the pain scale. The charge nurse, Maddie, needs to investigate what's happened.
Hi there, Emma. So I noticed that your patient still has a rating of 20 out of 10 on the pain scale, and you're supposed to give the narco. What's going on there?
So this is my 5th 12-hour shift in a row, and I'm just having a really rough day, so I may have taken it instead of giving it to the patient.
Okay, well, we're gonna have to take disciplinary actions for that. We cannot allow that because it disrupts the safety of you and the patient, anyone else you're working with.
Nurse Emma knows it's wrong, but that doesn't make her actions acceptable. She will be going to a rehab facility for 3 months, and upon return, she'll be under a preceptor. As you can probably tell, our paper was over drug addiction in nursing. The literature states that 10% of nurses today abuse drugs, which actually falls in line with the general population. This poses harm to everyone, patients, coworkers, and the nurse themselves. We noted things like staff shortages and how easy access can play a significant role. This paper discussed some factors leading to the use of drugs, how impaired nursing affects care, and the appropriate penalties that should happen. The references I used were what happens when a nurse has a substance abuse problem and nurses addicted to drugs, and they were both from a psychology article.
Okay, I'm going to talk about the analysis part of our paper. We talked about the pros, the cons, and then risk factors for nurses addicted to drugs. Some of the cons relate to jeopardizing patient safety as well as the being of the nurse. Another con in addiction is that when you're in and around the hospital all the time working, you have easy access to the medications. Some of the risk factors include nurses who are working more than 3 12-hour shifts a week, increased patient to nurse ratio, staff shortages, longer hours, and a high pressure on nurses from management. And then we believe that once someone admits their problem and follows certain criteria, that they should not be penalized by termination, but if it is a repeated offense, then they should be. Some of the pros, we are not justifying the issue, but we understand there is a problem. Having the courage to admit an addiction is what we think is like a big step. Doing so will create a better work environment for the nurse and may even allow for future advice to patients having survived the addiction. And then for this, we use the reference of Nurses Addicted to Drugs by Sid Dabi.
So I did the evaluation portion, and as Gwen mentioned, that about 10% of nurses actually struggle with this problem, and that is in line with the general population, which if you think about it, that's significant. Think about how many nurses there are to the population. So that means that 1 in 10 nurses have a problem, and 40% of those problems occur because they already are on a medication or they had been in the past. So something that does is it decreases the quality of care. As you could see, I did not give her pain medicine, so therefore she's not comfortable. So they can't provide appropriate care. It can cause confusions, memory loss, so you could even think that you gave her the medicine, but you didn't. And it's just patient neglect at that point. There are also medical errors that come with it, because if you think you're tired, you're confused, you have an impaired mind, so you're quicker to make those errors. Let's see. So as Kelly mentioned, there's an immediate investigation. They have to admit what they've done, but it's in a positive and supportive environment. It's never to criticize the nurse. It's always to help them realize that they have a problem. At that point, they would be enrolled into a treatment program for about 3 months, and then they could come back to work, but they would be under direct supervision. At that point, if there's another incident, that is upon the hospital to make that decision, and they may have to go against the board. But with that, there's the struggle of causing financial issues because that nurse has to be off work and they're not getting paid for that. Having said that, that leaves stress on the nursing staff because they're left short-staffed and they aren't expecting that. So all these scheduled shifts that this nurse is supposed to work, she can no longer do, so that leaves short-staffed and then higher nurse-to-patient ratios. It also produces stress because the coworkers are the ones that are supposed to identify the problem. They are the ones that are they're the ones that spend the most time with them. They're gonna see if the nurse, is picking up shifts that nobody wants to work, or if they're going to the Pyxis room by themselves and wasting meds that they're supposed to do with another person. They may be looking for reasons to be alone. They may be more tired. You're gonna see more of the problem. So at this, to wrap it up, it doesn't just affect the nurse, it impacts everyone, including the patient. So it's not just a safety issue on my part, it affects the care of the patient, it affects how coworkers are being treated, so it's kind of a holistic issue. So for those, I used the substance abuse among nurses, and that is by Ivy, and then is your nursing colleague impaired by Willis.
All right, well, I have the resolution. So there are two ways to look at treating and preventing drug addiction within nursing. There's prevention measurements that we could use within the hospital that can include more staff during shift, decrease in hours, decrease patient ratios, adjust demands from management, and adjustment of shift rotations. Whenever there's a lot of issues with those, it can lead to exhaustion and stress within the nurse, which can prompt them to become addicted to drugs or just take that as a way to cope with all the stressors that are coming from work. The treatment option, if the nurse already has an existing drug addiction, would be for rehabilitation. They will go sent to a rehab facility and they will become clean and then return back to work whenever they are able to. A non-disciplinary action which can be used is just referring or offering the nurse to a counseling or referral services. We do not recommend this. We believe that rehabilitation is what's needed for the nurse, but that's a non-disciplinary action we can use. I also did conclusion, and in conclusion, as we all talked about in summing up what we did, nurses are at risk due to the preventable factors which I just talked about in the resolution, and they can be avoided with those factors if they are adjusted. And whenever there will be lower risk factors, there will be a reduced abuse. And also rehabilitation is what we believe will be the best solution for nurses within drug addiction. For explanation, what we used is a self-awareness and judgment were the two critical concepts that we used. This is just all about perspective and point of view that we thought of. For self-regulation, we now feel as though we will be able to spot drug addiction within nursing by the signs, such as when they listed with like glossy eyes, sleep deprived, feeling anxious. We can now recognize that. So we feel more comfortable doing that after learning about this project. Whenever they do return, we believe that the nurse should be closely monitored by a preceptor, just make sure that we'll have no further problems after rehabilitation. And with that being said, we believe that the nurse should not lose their license unless it is a repeated issue that keeps reoccurring in the hospital. For my references, I used Nurses and Addiction by Gonzalez, Addiction and Medical Professionals by Juergens, and Nurses and Substance Abuse, How to Assess and Lead to Addiction by Redmond.